Good afternoon, student. Today we have early clinical exposure activity. For today's ECE, we have topic on the femoral hernia. Initially, I will quickly revise about the femoral triangle, femoral sheath, and the femoral hernia. Then the surgery lecturer will take over for the femoral hernia. So previously, we learned about the femoral triangle in detail about. Quickly, we will revise that femoral triangle is a triangular depression in the upper third of the thigh below the inguinal ligament. Here is the inguinal ligament. You know the attachment of the inguinal ligament. Medially, it is attached to the pubic tubercle and laterally, it is attached to the anterior superior iliac spine. Coming to the boundaries and the floor of the femoral triangle, it is a triangular space. Base is directed upward and the apex is directed downward. Base is formed by the inguinal ligament. Medial border is formed by the medial border of the adductor longus. Laterally, lateral boundary is formed by the medial border of the sartorius muscle. And the apex is formed by the meeting of the lateral and the medial borders. Okay. Now coming to the floor of the femoral triangle, it is formed by the from lateral to medial iliacus, tendon of psoas major, pectineus muscle, and the adductor longus muscle. So iliacus, tendon of psoas major muscle, pectineus muscle, and the adductor longus. These four muscles will form the floor of the femoral triangle. Roof is formed by the fascia lata, which presents some features like saphenous opening and the cribriform fascia. So in this diagram, you can nicely appreciate the fascia lata and which shows the saphenous opening. Apex is formed by the meeting point of the adductor longus and the sartorius muscles. At the apex, femoral triangle continue with the subsartorial canal. So here is the apex of the femoral triangle, which will continue as the adductor canal or the subsartorial canal. Contents of the femoral triangle from lateral to medial: femoral nerve with its branches, femoral artery and its branches, femoral vein with its tributaries, deep inguinal group of lymph nodes, part of the lateral femoral cutaneous nerve of thigh, femoral branch of the genital femoral nerve, femoral sheath, and some fibrofatty tissue. So these are the contents of the femoral triangle. Femoral sheath. What is femoral sheath? It is nothing but the oval funnel-shaped fascial tube which encloses the proximal part of the femoral vessels, which lies inferior to the inguinal ligament. Lateral wall of the femoral sheath is straight and the medial wall is sloping. In this diagram, you can nicely appreciate here is the lateral wall which is straight and the medial wall which is oblique. Base is directed upward and the apex merges with the tunica adventitia of the femoral vessels. Now you know what is tunica adventitia, so you can nicely appreciate that below the femoral sheath merges with the tunica adventitia. Formation of the femoral sheath. Anteriorly, it is formed by the fascia transversalis. Here you can see the fascia transversalis, and posteriorly by the fascia iliacus, which covers the iliacus muscle. Here is the iliacus muscle and here is the fascia iliacus. Its presence of femoral sheath allow the femoral artery and the femoral vein to glide in and out deep to the inguinal ligament during the movements of the joint. That is the importance of the femoral sheath. Now coming to the compartments of the femoral sheath. The interior of the femoral sheath is subdivided by the two vertical septa into three components: lateral, intermediate, and the medial compartment. The lateral compartment, which contains the femoral artery, intermediate compartment contains the femoral vein, and the medial compartment is known as the femoral canal. So here is the three compartments of the femoral sheath: lateral compartment with the femoral artery, intermediate compartment with the femoral vein, and the medial compartment, which is known as the femoral canal, which contains the one lymph node, that is the lymph node of Ploquet. Okay. So here also you can appreciate the femoral sheath with its 3 compartments. Coming to the femoral canal, it is the medialmost compartment of the femoral sheath. Here you can nicely appreciate the femoral canal. It is a short fascial tube which is reduced rapidly in width from above downwards. Here you can appreciate it is broad in the upper part and rapidly it reduces in its size width. It is closed inferiorly by the fusion of its wall. Upper end of the femoral canal, which opens into the abdominal cavity, is known as the femoral ring. So upper end of the femoral canal is known as the femoral ring. Cloquet lymph node is situated in the femoral canal. Femoral ring. Upper opening of the femoral canal is known as the femoral ring. It is directed towards the abdomen. It is closed by the femoral septum, which is made up of extraperitoneal fatty tissue. Boundaries of the femoral ring. Laterally, it is bounded by the medial septum here. Laterally, it is bounded by the medial septum, anteriorly by the inguinal ligament, posteriorly by the pectineal ligament or the Cooper's ligament, medially by the free margin of the lacunar ligament. Here is the free margin of the lacunar ligament. So the boundaries of the femoral ring are laterally, it is bounded by the medial septum, anteriorly by the inguinal ligament, posteriorly by the pectineal ligament or the ligament of Cooper, and medially by the free margin of the lacunar ligament. Clinical anatomy. Femoral ring is the weak area in the lower part of the anterior abdominal wall. Femoral hernia occurs when the abdominal viscera or the omentum passes through the femoral ring into the potential space of the femoral canal. So the femoral hernia occurs when the abdominal viscera or the omentum passes through the femoral ring and into the potential space that is the femoral canal. Femoral hernia accounts for 5% of abdominal hernias and it is more common in women than the men. It is 3 times more common in the females. Risk factors include sex. Both sexes can develop the femoral hernia, but they occur more often in females. This because of the female pelvis is wider and the pregnancy. Because of the multiple pregnancy, the anterior abdominal wall muscles may become weak. Age of the patient, more common in adults than the children. And if there is family history of the femoral hernia, in that cases, it may occur in the families. Femoral hernia present as a globular swelling in the groin. Here you can appreciate the globular swelling in the groin. It is located inferolateral to the pubic tubercle. It is located inferolateral to the pubic tubercle. Path of the femoral hernia is at first downwards, then anterior, and then upward. Femoral hernia is very prone to complications requiring urgent surgical intervention because of the concave margin of the lacunar ligament. Okay. So here is the sac of the femoral hernia, which lies lateral and inferior to the pubic tubercle. Here is the pubic tubercle, and here is the sac of the indirect inguinal hernia. So here is the femoral hernia, and here is the lacunar ligament. Here is the femoral ring. Femoral coverings of the femoral hernia from inside out are peritoneum, femoral septum, transversalis fascia, cribriform fascia, superficial fascia, and the skin. So these are the coverings of the femoral hernia. Coming to the differential diagnosis of the femoral hernia. Femoral hernia, you must able to differentiate the femoral hernia from the inguinal hernia. Femoral hernia lies below and lateral to the pubic tubercle. Here is the pubic tubercle. You can appreciate that the femoral hernial sac lies below and lateral to the pubic tubercle. Whereas in the inguinal ligament, the femoral sac lies above and medial to the pubic tubercle. Other differential diagnoses are saphenous-varis. Saphenous-varis is nothing but the dilated saccular upper end of the long saphenous vein with the varicosity. It disappears when the lying down. Thrill may be felt on cuffing. Lipoma, it is a soft lobular swelling which slips under the palpating fingers. Femoral artery aneurysm. It is a pulsatile swelling in the groin with a continuous murmur. Enlarged femoral lymph nodes. Enlarged femoral lymph nodes are firm and round. Enlarged in the lower limb because of the infection, abrasions, wound in the perineum, and also in the carcinoma of the penis. So these are the causes of the enlargement of the femoral lymph nodes. Psoas bursa. Osteoarthritis of the hip can produce the distension of the psoas bursa, but this psoas bursa disappears on flexing the hip. Then the one most important differential diagnosis is the psoas abscess, which occurs due to the tuberculosis of the spine. Two swellings are seen here. One is above and one is below the inguinal ligament. Cross fluctuation between the two swelling is present. In these cases, there is tenderness on the spine, and spine X-ray shows the tuberculosis of the vertebra. Now we will see the differences between the inguinal and the femoral hernia. Femoral hernia is more common in the females than the male. Femoral hernia passes through the femoral canal, while the inguinal hernia passes through the inguinal canal. Neck of the sac of the femoral hernia lies below and lateral to the pubic tubercle, while the neck of the sac of the inguinal hernia lies above and medial to the pubic tubercle. Femoral hernia is not able to reduce completely, but inguinal hernia can be reduced completely. Strangulation is more common in the femoral hernia. Cuff on impulse is absent in the femoral hernia, while it is present in the inguinal hernia. Surgery is compulsory for the femoral hernia. Inguinal hernia may be treated patiently, or you can wait and watch for the surgery. Sac mainly contains omentum in the femoral hernia, while in the inguinal hernia, sac mainly contains the bowel. So this is all about the femoral triangle, femoral sheath, and the femoral hernia. Okay. Now the applied aspect will be taught by the discussed by the surgery lecturer. Thank you.